Hello class, what I want to do now is go over the lab content that we would have covered had we had class today. We're going to look first at this tissue integrity case study. It starts off with Roger is a 70-year-old male that's admitted to the hospital from home for altered mental status with suspicion of a urinary tract infection. He is 5 foot 10 inches tall and he weighs 275 pounds. He lives at home alone and was discovered confused when the Meals on Wheels delivery person dropped off his lunch. He receives 3 meals a week, but often doesn't eat them, preferring to run through a fast food drive-thru in order to get out of the house a few minutes. And my first question is what's on your paper right here. Do you have questions about Roger and his daily life regarding tissue integrity? I want you to think about this for a minute. As I read this very short paragraph, I was concerned somewhat of the fact that Roger is somewhat confused and does have an altered mental status. So my question then is, why is he living alone and why is he driving a car? So if he is confused, how is his overall self-care? How is he caring for himself in regards to his hygiene, nutrition? Even though the Meals on Wheels are coming to his home, he is not eating those foods. So where is his nutrition coming from? We're just thinking about his home environment, and we want that home to be a safe place for this patient. And it's even more concerning when we know that the patient does have some periods of confusion. And then, of course, we would like to know a little bit about his health history. Does he have any illnesses which would create specific skin issues? Any type of metabolic diseases such as diabetes? How does he receive foot and nail care? As you can tell from his height and his weight, he is somewhat obese. So I'm really concerned again with his hygiene, that he has many skin folds that probably get very sweaty and are very, very moist. So this is a great media for fungal infections. And because of his weight, I'm also concerned about his mobility. Is he fully mobile? And again, looking at his home environment, really doing a safety check in regards to does he have stairs? Are there rugs around the house that could unfortunately be a safety hazard? How is his kitchen set up? Is it safe for him to use such things as knives, the oven, the microwave, the stove? All these things are kind of the questions that are going through my mind. And then you want to go back to our assessment interviews, which we talked about earlier in the course, the ones with D'Amico and Barbarita, that talks about the focus interview questions. So my question to you is, what questions would you like to explore further with Roger? We don't know of a skin problem yet. Maybe it's something that we have to continue to probe about as far as asking questions. But there could be a lot of what am I trying to say? Some safety issues, which could definitely cause him to have alterations in his skin. Has he been one of those people that he's been out in the sun a lot? Has he been exposed to toxins? What kind of soaps is he using? Does he have any history of skin problems? And obviously, we need this patient assessed from head to toe in regards is what's the condition of his skin at the present. So let's continue to read more about this patient. We might get a little bit more information about his health and about how he functions around his own home. Roger suffers from arthritis, which makes moving painful. He often sleeps in his recliner to avoid climbing the stairs to go to bed. Roger usually showers once a week before his son and his grandkids come to visit. So what new problems are you finding in the case? Well, this is a great information because now we know that his mobility is definitely affected because Roger does have arthritis, which definitely affects the way he moves. And obviously his weight doesn't help matters as well. He sleeps in his recliner to avoid climbing the stairs, so now we know that his house has stairs, and maybe his bed isn't user-friendly as well, which could be an issue, especially if he has any underlying cardiac or respiratory problems. Maybe he needs to have his head of the bed elevated in order to sleep, which we call orthopnea, and that could be an indication that he does have some respiratory or cardiac issues. He's only showering once a week, and the only reason he's doing that is to kind of put on a big show for his son and grandkids, maybe to elicit the fact that, you know, he's able to take care of himself. But even with anyone with his weight and his health issues, showering once a week is not really a very good healthy hygiene practice. So my question to you is, do you think this is a good idea for him to sleep in a recliner to avoid climbing the stairs to go to bed? Why or why not? And why is he avoiding climbing the stairs? And why do you think it's important for him to shower before his son and grandkids visit? And I think I've answered that already. And does he know that his hygiene is not good? Maybe he thinks he's fooling his family, but they may really notice that, you know, the once a week shower is really not doing the trick. He still may have, you know, body odor, and we want to know if he's able to put on fresh and clean clothes. And if he is he able to do his own laundry safely, or is he not even aware that he has laundry to do? And is it safe for him to use the washer and dryer? So what new problems are you finding in the case? And obviously we're finding much more about Roger, which continues to give us high concern about his living conditions and really doubting the fact that he's able to care for himself on his own. And what other kinds of concerns do we know more about Roger and his daily care? If his self-care is neglected, then we might assume that his oral care, trimming of nails, laundry, attention to home management might also be lacking. And obviously, is there anyone getting in there cleaning the house? So he may be living in a situation where the house has not been very clean. Bathrooms, changing the sheets on the bed, having fresh towels for, you know, the kitchen as well as the bathroom. So let's keep moving through this evolving case study, okay? And right here it says, upon assessment, you notice his skin has loose turgor and his capillary refill is delayed in his fingers and toes. He has a strong body odor, and you assist Roger to the bathroom. There is stool dried around his rectum and winces when you clean him. Now we're getting even more information about his hygiene, which again is even more concerning. Think about how we do assess turgor. And is loose skin turgor unusual in a 70-year-old? Because remember, that's what his age is. Could it have anything to do with his nutrition? And what else do you want to know? Is this his usual weight, or has he lost weight? To me, it seems like he was even heavier than this. And with that loose skin turgor, he's probably losing weight due to the fact he's not eating. And again, as we look at his nutritional status, we also want to look at his hydration status as well. Obviously, he may think that he's having a shower once a week, but the important thing is, what is he doing in the shower? Is he cleaning himself appropriately? especially in the private areas under the arms. And what's very concerning is he has that dried stool around his rectum. Obviously, it's causing him some excoriation of the area. So this is very serious, because now we do know that he has some alterations in tissue integrity. This is a perfect media for him to have skin breakdown. We're concerned too about his capillary refill. It's delayed in his fingers and toes, which definitely points to the fact that he does have some oxygenation and perfusion issues as well. We'd also like to know, does he have any swelling, and thinking about pitting versus non-pitting edema. So I'll let you think about what is the difference between the two. We will talk about that in more specificity when we get to the perfusion concept. Obviously he has some issues with toileting, and maybe because of his size and his arthritis, he's not able to clean his body as well after having a bowel movement. So stool and urine on the skin is going to cause some further irritation. And since we're concerned about his nutritional status, we're very concerned about his urinary output. Is he drinking enough? So the urine may be very concentrated, which further adds to a problem with his skin integrity. Okay. Patient is not in very good shape. This is a very sad situation, and hopefully when the son and the grandson come to visit, they'll be able to see that their father and grandfather is living in a very unsafe situation. Along with his hygiene, I would definitely like to look at his hair and his scalp. Hopefully he has no parasitic problems with lice or anything like that. So I definitely want to do an inspection on that. Look at the scalp, and to be sure that there's no lesions or sores or anything like that. So the next question is, what questions would you ask Roger to explore this problem more completely? We know that his circulation is sluggish, being that his capillary refill is delayed. Are the nails forming well? What is the color of the nail beds? And are his hands typically cold? We do not know Roger's race, so please discuss variations with light and dark skin. And I think I talked about that in the lecture about tissue integrity. Again, we're finding some more information about the patient. We see that, sorry, I went too far. Quite a bit farther, sorry about that. Let me bring it back to our case study. Follow along, you'll see that you observe a small red area on his left elbow. When you ask him about it, he mentions that it is from pushing around the arm of the recliner as he naps. He states that it burns when he urinates, so he has decreased the amount of fluids he drinks so that he doesn't have to urinate as much, which obviously leads me to the fact that he is dehydrated because his urine is very, very concentrated. And Roger may at this time have a urinary tract infection. And here we go. So do you like the reasoning Roger is applying to his health concern? Burning on urination is a bad sign and should not be ignored. This is not unusual in the older adult regarding voiding practices, but how does it affect his overall health with hydration, healing, and skin integrity? This is not a good thing because he's very much at risk for developing a UTI, which is an infection, and if it's not treated properly, particularly someone of his age, this patient could end up becoming septic. This could be the reason for his altered mental status as well. So this hydration will definitely affect healing, and it definitely affects skin integrity. He already has now excoriation around the rectum. He also has a small red area on his left elbow. So now he is demonstrating skin breakdown. And it is painful. And again, now he has an open wound, which again is at risk for infection. So what will the focus for your teaching be? I'm not sure a patient like this can be taught. I think we need to address his medical issues first, and that is about his nutritional status, what types of assessments we found on him already as far as his decreased perfusion, decreased capillary refill, decreased amounts of urine, in which the urine is very concentrating. That does affect his hydration status. We need to find out what the cause of his mental status is. Obviously, he would be a good candidate to admit into the acute care setting. And first of all, let's do a thorough assessment and draw labs on him. Probably do a chest x-ray, do a EKG, and other additional lab work that's appropriate for how the patient is presenting. Might be a good idea to talk to the son and the grandson, particularly the son, if he's his legal guardian. This is where you begin the teaching and explain how serious this situation is. Identify the risks that can be modified by Roger if he changes his current habits, and the risks that cannot be modified. I would definitely look at, first of all, if this patient is safe once we get to the point where we've treated the UTI, we've looked at the skin breakdowns, and we've definitely addressed his mental status, if this patient really is a candidate to live by themselves. Something to think about. And if we were going to implement some teaching with this patient, I would advise you to look on page 1593 on the table 21.6, age-related skin changes. What happens with the epidermis, dermis, and the subcutaneous skin layer. Very important to understand what the physiological changes might be in someone who's age 70. Okay. So we can kind of sum up the information regarding our patient Roger, who is 70 years old, looking at those modifiable risk factors. Think about what you would put in that square. Skin care and maintenance. We would hope that the skin would be clean, dry, moisturized. We would encourage them to avoid irritants or allergens. Participate in screenings and health reviews for chronic diseases and medication effects. Teaching the patient about self-examination, and see a dermatologist for concerns properly. And when we talk about non-modifiable risk factors, obviously gender. Men are more susceptible to infectious skin disorders, and women to pigmentary and autoimmune disorders. What are the patient's family history of skin disorders? And assessing skin color. Like I said, we don't know what ethnic group or race this patient belongs to, but light tone versus dark tone are susceptible to certain disorders. And you would find that information on page 1452 of your volume 1 concepts book. So let's take a look at that and see if there's anything that is important to address. 1452. Not sure if that's correct page number. I'll have to look that up for you. And then, of course, evidence of current skin alterations. We have a red elbow, we have reddened and tender rectum area, and poor hydration and a decreased skin turgor. And what would you teach to correct the alteration? Encourage reducing pressure points, hygiene after toileting, and maintain hydration. So those are some of the key points that we would probably look at as well. Okay. And what assessment techniques would be important to use to carefully examine his tissue integrity? Obviously, color, tone, cleanliness, perspiration, odor, pigmentation, and circulation, vessels, things like that. Palpating the skin, temperature using the dorsal surface of the hand, assessing for moisture, texture, thickness, elasticity. Does the patient have any edema, presence of lesions, bruising, or any sensitivity to touch? So this is how we would, look at this information as well. So I hope this helps kind of reviewing this patient situation, this evolving case study that really shows that we have a patient that's really in really bad shape. Okay. As I continue to move down your lab forms, the first one here is assessing the skin, review of the systems. Ask your lab partner the following questions. I'm not going to read through these. I want you to be sure that you look over these. What kinds of questions would you ask somebody in regards to their skin? So please be sure that you look over these questions and understand each of those questions and what is the importance of finding that answer to that question. And then again, assessing the hair. Very important, okay, because the texture and the quality of that hair could signify other problems. Patients who develop thyroid issues may have changes in the quality of their hair, so it's very important that you do assess the patient's hair. Kind of learn a little bit about how they take care of their hair in regards to the use of hair dyes, rinses, or curling, straightening preparation. Obviously, chemotherapy is one drug that will definitely affect someone's hair. Are there any acute or chronic conditions that affect hair growth or distribution? And not only looking at the hair on the head, but what about the hair throughout the body as well? Is there places where the patient should not have hair, or is there places where the patient should have hair and the hair isn't there? We see this in a lot of patients with peripheral vascular and circulatory problems. They have very limited hair, especially on their lower extremities. Okay. Looking at fingernails and toenails, the health of those is very important to assess as well. Now we come across dental health. And this is especially important when we're talking about children's health, children's dental health. And I'm going to show you 3 videos here, which we'll kind of talk about each one and compare each one as well. But I think it's also important, as I mentioned with the lecture, about assessing our adult patients' oral hygiene and what kind of shape, if our patients do have dentures or partials, what kind of shape those particular devices are for our patients. Do they fit properly? Are they being cleaned properly? How long have they had them? And then in regards to that, we would also like to assess findings such as condition of the lips, condition of the buccal mucosa, how are their gums, their teeth, their tongue, condition of the upper hard and soft palate, condition of the floor of the mouth, presentation of tonsils, movement of the uvula, presence of odor. And here's a great question: which cranial nerve is intact when the uvula rises midline? And the answer to that is number 9 and number 10. Okay, and that would be the glossopharyngeal and the vagus nerve. So you might want to look those up as well. All right, so let me play these videos, okay?
We brush to remove plaque and stay clean.
What's plaque?
Plaque is yucky stuff that can
Yay!
stick to
Time
teeth.
to brush. Why do we
Plaque
brush?
is bad
We
because
brush
it's full of
to remove
nasty
plaque
germs.
and stay clean.
These germs can hurt teeth by making little holes called cavities. Plaque and cavities make teeth weaker. That's why it's super important to brush all the plaque off every day. To keep healthy teeth, we have to brush for 2 minutes every morning and 2 minutes every night before bed. It's really important to brush your teeth the right way. First, make sure to use a special kid's toothbrush when you brush. Kids' brushes fit little mouths and have soft bristles. Put a little dot, about the size of a pea, of fluoride toothpaste on your brush. Parents have to help babies brush their teeth, and babies can't use fluoride toothpaste. You have to be able to spit to use fluoride. Once you have the toothpaste on your toothbrush, open your mouth wide. Start with the teeth in the back of your mouth and brush in little circles. Work your way to the teeth in the front of your mouth, and don't forget to brush the gums. Move the brush back and forth, gently in short strokes. Brush the top, front, and back sides of each tooth. Make sure you get the insides of all the teeth. When you're done, be sure to spit out all the toothpaste. Don't swallow the toothpaste. It will upset your tummy. When you're done brushing, it's time to floss. Flossing can help remove food and plaque from in between teeth and along the gum line. Parents should start flossing their children's teeth as soon as they have 2 teeth that touch, and they should floss twice a week. When you floss, break off about 18 inches of floss. Wind the floss around your pointer finger. Hold the floss tightly between your thumbs and your fingers. Guide the floss between your teeth using a gentle rubbing motion. Never snap the floss into your gums. When the floss reaches the gum line, curve it into a C shape against one tooth. Hold the floss tightly against the tooth. Gently rub the side of the tooth, moving the floss away from the gum with an upward motion. By the time you're 7 or so, you should be flossing every night at bedtime with your mom or dad's supervision. One other way we can keep our teeth clean and healthy is by eating and drinking healthy foods. Eating healthy foods for breakfast, lunch, and dinner is the best way to keep your teeth and whole body in good shape. If you're hungry and want a snack, try foods like fruit, raw veggies, and low-fat cheese. Stay away from sugary sodas and sweets. If you're thirsty, drink water or low-fat milk. If you brush, floss, and eat right, you'll have a beautiful smile for your entire life. Find a My Kids Dentist location or request an appointment today by logging in at www.mykidsdentistonline.com.
Find a My Kids Dentist location.
Alright, here's video 2 that I want to show you. Please keep in mind, we're going to compare all 3 of these videos.
Wanna help me catch some invisible nasties? You know, those little germs that hide in your mouth? Try to ruin your smile? Gross, huh? They're too small to see. So, we'll have to use our imagination. are best. Next, fluoride toothpaste. Fluoride makes your teeth stronger and helps protect them from the nasties. Do you see fluoride on your toothpaste? Good. Now, add a pea-sized drop of toothpaste to your brush. Hold your brush so it points at the space between your teeth and your gums. The nasties like to hide up there. Now, start brushing in tiny circles over every tooth. I go from the left side of my mouth to the right. That way, I never forget which teeth I brush. Get the tops, the sides, the fronts, and the backs. The nasties think you won't find them in the very back. They're so wrong. It takes 2 minutes to brush all the nasties away. I used to make the time go by faster by singing a song. It sounds funny with the brush in your mouth. Wah, 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 wah. When you're finished brushing, don't swallow. Just spit those nasties right down the drain. I'll be back tonight, invisible nasties. Our smiles are safe for now. But we'll have to come back every morning and night to catch the new nasties. For an extra clean, ask your parents to help floss. And, oh yeah, make sure to go to the dentist twice a year. See you next time.
All right, here we go with the last video, video 3.
When I am helping a customer, I need to treat everybody the way I would want them to treat my family. I am a country girl, so that
First, take your toothbrush. Next, add a small amount of toothpaste. Now, brush. This is the way we brush our teeth, brush our teeth, brush our teeth. This is the way we brush our teeth. We do it in the morning. Brushing up and brushing down, left and right and round and round. A nice wide smile will then be found. We brushed really well. This is the way we brush our teeth, brush our teeth, brush our teeth. This is the way we brush our teeth. We do it in the evening. Brushing left and brushing right, brushing till our teeth are bright. Then we say, oh, good night, we've brushed really well. This is the way we brush our teeth, brush our teeth, brush our teeth. This is the way we brush our teeth. We do it twice a day.
I think if we look at all 3 videos, they were all pretty good. Can be quite entertaining for children. I think the first 2 really did give specific instructions, and they were pretty consistent about those instructions. How long to brush, how much toothpaste to use. They did recommend, and teach the kids not to swallow the toothpaste because it could make their tummy ache. The third one was more of a catchy tune. It talked about the fact that you brush in the morning and the evening, but it didn't really give specific instructions, and it didn't really show kids how they should brush. Going like the young girl in the second video said, she goes from left to right to be sure she doesn't miss any of her teeth. So, I mean, they were all pretty good, but if you kind of want to know to do what you're going to do exactly for your kids, I think the first 2 were probably better. Were much more educational for kids as well as parents. But they were all cute. So you might want to be able to look at Site 1, 2, and think about the pros and the cons. what site do you think was the least effective in describing information on good hygiene care? And I think that would be the third one. Make sure you view the Pearson video on hygiene, oral care, and brushing teeth. And as I said before, looking at all the different areas of the oral cavity and how we can assess that and offer advice as to what we can do to keep that area much healthier. Okay. So, and think about too, what's a great way to be able to provide proper denture care, safety as well as hygiene. So that's pretty much all I have to say about our lab. Now, obviously, it would have went on a lot longer had we been in person, and that we could kind of talk about the discussion of these questions. But this is things that you can work independently on, and of course, going back to those assessments, please be sure that you are looking at, assessing the skull, the hair, the nail beds, and the overall assessment of the skin. If you have any questions about this, please let me know. This video is about 37 minutes long, so review the case study that I just went over with you as well, and kind of think about what were the important points that we talked about. Okay, have a great night, and let me know if you have any questions.